guys, Dr. Lavan. So I'm with Tim again from Surrey Physio, who's a good friend of ours, and we're now going to be talking about lower back pain, but more specifically things like sciatica. Now, I wanted to bring this subject because there were a few of you followers who'd actually contacted me and asked could we have a sciatica specific video, but I think for me myself, I know Tim, over the last few months I've actually noticed quite significant lower back pain. And we are at our desks more the typical way of seeing patients where they'd come in, we'd get up, we'd have a chat, examine and send them off. We are doing a lot of our consultations via telephone now. And as a result, we are sitting in our chairs for many, many hours. And I'm really noticing this lower back pain amongst a lot of my other colleagues as well, struggling. So I wonder whether we could have a chat about kind of the lower back pain, the posture, how we're sitting at our desks with our lower back, but also what things we could possibly do to improve that.
Yeah, absolutely. And lower back pain is really, really common anyway, but we've seen a big increase in incidence since the lockdown. Can I use an example?
Please do.
My mum, bless her soul, she's a lovely, lovely lady. I saw her this morning. My sister went around there and found her lying on the floor with horrific sciatica.
Wow.
Okay, really, really bad. She went on diazepam, she went on cocodamol, she went on naproxen, and she was really, really bad. And it was just, it was in April, and it was just, or May, and she wasn't getting her normal walks in and her normal exercise. Okay. And she was doing a lot of bending, she was doing a lot of some stuff around the garden when the weather was good, and she was doing a lot of bending and clearing, and she ended up getting this very nasty disc problem.
Wow. It
was a real nightmare, and that was my mum. It's that common, guys. Sciatica is massively prevalent. It's a real problem.
Okay. And I guess that's a great example because I guess a lot of our patients have actually been doing a lot around the house and a lot of gardening. I guess the plan, is there stuff we can do to prevent it? Are there exercises to strengthen, or is there things that we need to take medication wise or vitamins? What's your general advice on how to prevent sciatica from developing in the first place?
Well, sciatica is a really interesting condition, and what it is sciatica is basically a pressure or compression on the nerve in the lower back that sends pain down the back of the leg along the course of the sciatic nerve. Now, the biggest cause of sciatica tends to be when a disc bulges backwards. The disc can bulge backwards and pinch the nerve. So if we look at a spine, here's our spine, and we've got this curve here. This is the lower back or the lumbar spine, going into the thoracic spine, going into the cervical spine. Now these things in between the vertebrae, these square blocks, these are the vertebrae, these are the bones, and these softer bits, these are called discs. And what can happen is with repeated stress or degenerative change, the disc can actually bulge backwards, and you can see a sort of one here. The disc can bulge backwards, and these yellow things, these are the nerves. Now when usually these two bottom discs bulge backwards and touch this nerve tends to go down the back of the leg, and that's when you get sciatica. And I've just got to say, it's extremely painful. So don't be surprised if you are in a lot of pain with it, because it's like a nerve pain. It's always a very severe form of pain, right? And also the other thing about nerve pain is it presents in different ways. Like some people get nerve pain where it shoots. Some people get stabbing pain. Some people get spider tickles. Some people get numbness. Some people get sort of a deep, dull aches. And nerve pain can present in different ways, but it tends to go down the back of the leg, to the calf, sometimes into the foot. There's lots of things you can do, and the best way to prevent disc problems is essentially to keep your body fit, strong, flexible and healthy. Do good things to your body and your body will be fine. The spine is designed to move. When the spine stops moving, then you can have problems. Exercise, look after your body, eat good food, have good nutrition. If you don't have or can't do, then of course vitamins can supplement as well, as you alluded to. Exercise, swim, cycle, walk, hike, do classes, whatever it takes to keep your body, back, core strong. And I think, in my opinion, one of the biggest factors that we see with people who get disc problems, unfortunately like my mum, is people that tend to do a lot of repetitive forward bending. I'm not saying don't bend. What I'm saying is that we tend to see a characteristics that people that bend forwards a lot. Is what happens is you bend forwards, you see. Let's say you're in this position a lot. It tends to put pressure through the front of a disc, which can bulge the disc backwards. One of the first things I do when I see someone with sciatica is I straight away tell them to avoid forward bending. It's one of the most important things you can do. Do that for 3 or 4 weeks to take the pressure off the back. Because again, it's just the whole thing about gravity. When you're bending forwards, you're putting a lot of gravity goes through the full weight, and you're hinging off the bottom of your spine. So it puts a lot of stress through that area. And so also, if you're stuck, go and see a GP. I mean, what would a GP do in the early stages of managing with someone with sciatica?
We'd send over to you guys.
That's good. I like it.
No, so I think all the points you'd made about trying to prevent it, so actually exercising, mobility, even if you are having pain, in sometimes we actually do encourage a little bit of medication just so that they can fulfill their full movement. Sometimes when they're restricted, they say, I'm in too much pain, I can't move, and they just end up lying in bed all day. So we say, no, actually, if it means taking a little bit of medication to allow that mobility to occur, we really push for that. I think a big part of our job is, sadly, we do need to be quite blatant and obvious at times, and actually if obesity is a problem, so if there's a lot of weight on there, my understanding is a lot of the weight, as much as it can affect the knees, the feet, actually a lot of it does go towards that lower back. So actually having that conversation about weight, I find when there is that, where the patients actually do understand this, they change their lifestyle, and even without doing too much, that drop in weight can significantly help.
It really can. The thing about being overweight as well is that overweight people tend to be more sedentary. So you tend to move less. And we know this spine is designed to bend and move. So if it doesn't move, you've not only got the pressure on the back from the weight, but you've got the fact that you're probably likely to be more sedentary. And then you've got a big problem, because if you get sciatica or you get back pain, you very quickly get into a vicious circle.
Yeah.
The vicious circle is, I'm in too much pain to exercise, and I can't lose weight because I can't exercise because I'm in pain. So how do I lose weight when I can't exercise because I can't exercise because of pain? You see, you get into a vicious circle, and you have to break that pattern. So you can use medication, you can use exercises, you can use lifestyle advice, guidance. Stay mobile, get the back moving. If you can't because it's so painful, you have to lie in bed, fine, but get up as soon as you can or are able to. And the medication does have a place because it does give you that window to get moving, to reduce the pain, to exercise, to mobilise the spine. And then after that point, once they've gone through that point, then of course you can see a physiotherapist to exercise, or you can follow the advice sheets to do the right exercises for your back.
Great. And my last question, Tim, about sciatica is, once you do give the advice about exercises, as with the way all of us work, we don't tend to always follow it through, or we don't carry on doing it. Is the advice, as if you are known to have a sciatic problem, would you carry on doing these exercises potentially for a year, 2 years, lifelong? Or are you in a position where actually it can be fixed and you don't really have to worry about it, and then maybe in a later stage you reconsider?
Unfortunately with sciatica, because it tends to be a disc problem, so the disc tends to bulge, you do tend to find that sometimes it can come back. I've suffered sciatica myself. I had it quite badly about 15 years ago. It took me a long time to get over it, and I had to have quite a lot of physio to get me over it. And it does come back and rear its ugly head. And I find that it's the times when I don't do good things in my body that it tends to come back. When I'm constantly bending over patients because I forget about my own good posture, or I'm not exercising enough, then I tend to, if I've been sedentary, sitting all day, I tend to get a bit achy in my back. I would say it's always a good thing to do the right exercises for your back. And it's hard to stay motivated, but just spending 2 or 3 minutes a day, that's all it can take, just to keep the back mobile, keep your core and back strong, I think can be hugely useful. So a little bit of exercises every couple of days, I think is a really good thing if you can.
A good point you mentioned there. I mean, the assumption, especially for even as clinicians, is it's your back, so therefore all the exercises, the effort should be on the back. But I kind of gathered here, is there a possibility that, say you're talking about these core muscles, does doing other exercises in certain areas around help to improve the back as well, or do we just focus on back exercises?
100%. We were, early stages we'll probably focus on back exercises like mobility stuff, so let's get the back moving. And further down the line we'll start to actually look at other areas in the body. Now you've probably heard of the term core stability. We don't use that term that much these days. We actually think that the body should be strong. You know, your core is one part, it should be strong. Your back is one part, it should be strong. Your hips are one part, it should be strong. Your pelvic floor should be strong. Your, you know, all these different areas should be strong. Your ankles should be strong. You know, we need to get our bodies strong. If we look at our levels of strength and fitness compared to probably our grandparents, they are probably less in our generation than what it would have been, you know, 40 or 50 years ago. We probably don't exercise as much, so we probably don't have the same levels of strength or conditioning of our bodies. If we keep our bodies strong, we're less likely to have problems. That includes the core, that includes a weak ankle, that includes the pelvis, the chest, the shoulder blade muscles, the neck muscles. We need a strong body. That's how we prevent pain.
So guys, the last video and the ending of this session is about the back, and the typical case is me. I'm working really hard, my lower back's causing a problem, my posture's probably very poor at work. I've come to Tim straight out of work, I need help, I need improvement. I've potentially got some sciatic nerve problems, but even any exercises would be great. So Tim, how can you help me?
If it's quite acute and your sciatica is quite fresh, I'm just going to tell you, Lavan, let's just avoid repetitive forward bending. Okay, just offload the back, let it settle down. So just things like cleaning your teeth, making the bed, you know, it's putting a lot of pressure through your lower back here. And this was a big cause of why I got a disc problem, because I was constantly bending all the time. I'm not saying you can't bend for the rest of your life. What I'm saying is just for 3 or 4 weeks, let's reduce the bending to take the pressure off your back. Okay, so let's just be mindful of our posture, keeping us in alignment, straight, good. If you're going to lift, you need to pick something up. Make sure you just squat and bend the knees. Okay, so we tend to just bend too much like this, and it puts a lot of pressure for us. But if we just stay in alignment and squat and hold things close to us, this is super important if you've got young children. You know, or go down onto one knee. You know, if you've got to get low and you want to make a bed or put your shoes and socks on and you're in pain, you can do it on one knee and just bend like this, and it's much, much safer for the back. Or picking up kids. So let's first of all just be like offload the pressure on our back. And there's some cool exercises that you can do. I mean, a good exercise will be a side flexion exercise. All we're going to do is just run the right arm down the right side. All right, good. And then left arm down the left side. Okay, so right arm down the right side and left arm down the left side. So that's just a good mobility exercise for the back. There's also a really nice one which I won't demonstrate, but it's where you lie on your back and you just rotate your knees to each side. So you just bend your knees, rotate them to each side with your feet flat on a bed. If these are really good if you're bed bound. And another good exercise is also you can just gently rotate the back as well. Just imagine you're going to like reach over your shoulder or twist. Just to get that mobility to the spine is really, really good. You do these exercises 5, 10, 15 repetitions. Do them once, twice, 3 times a day. There's no real rules about it, but you just kind of listen to your body and see what you can do to, what you can achieve. Keep within your comfort zone. If you get pain or it feels like it's making things worse, of course, just stop the exercise. Seek professional advice from a doctor or a physio, and just get your back assessed.